Welcome to this educational video about corneal dystrophies. In this video, we'll explore what corneal dystrophies are, what causes them, how they affect the eye, and what treatment options are available. The cornea, that clear front window of your eye, is essential for clear vision. Corneal dystrophies are a group of inherited disorders that can cloud or damage this vital tissue. Corneal dystrophies are primarily caused by genetic mutations. These mutations disrupt the normal production and function of specific proteins within the cornea. In most cases, these genetic mutations are passed down from parents to their children, making corneal dystrophies hereditary conditions. However, spontaneous mutations can also occur, although this is less common. The specific gene affected determines the type of corneal dystrophy and its characteristics. The pathophysiology of corneal dystrophies varies depending on the specific type, but the general mechanism involves the abnormal accumulation of substances within the cornea or the structural breakdown of corneal tissue. These abnormal deposits or changes can affect the clarity, thickness, and overall integrity of the cornea. Over time, this can lead to clouding, scarring, and irregularities on the corneal surface, which ultimately impacts vision. Corneal dystrophies are relatively rare conditions, affecting individuals worldwide. The exact prevalence of each specific type varies depending on the population and geographic location. Some dystrophies, like epithelial basement membrane dystrophy, are more common than others, such as lattice dystrophy. While prevalence varies, it is important to understand that most corneal dystrophies are not gender or race specific and can affect individuals of all backgrounds. The signs and symptoms of corneal dystrophies can vary greatly, both in severity and presentation. Some individuals may experience no symptoms at all, especially in the early stages. Others may notice blurred vision, glare, halos around lights, or foreign body sensation, pain, light sensitivity, and episodes of corneal erosion, where the outer layer of the cornea breaks down, can also occur, particularly in certain types of dystrophies. The symptoms often fluctuate over time, with periods of stability and periods of worsening. Diagnosis of corneal dystrophies typically involves a comprehensive eye examination by an ophthalmologist. This includes assessing visual acuity, examining the cornea under magnification with a slit lamp, and measuring corneal thickness. Additional tests, such as corneal topography, mapping the corneal surface, and confocal microscopy imaging the corneal cells, may be performed to provide a more detailed evaluation. Genetic testing can be used to confirm the diagnosis and identify a specific genetic mutation responsible for the dystrophy. Corneal dystrophies are classified based on the layer of the cornea affected and the specific abnormalities observed. Some of the most common types include epithelial basement membrane dystrophy, also known as MAP, fingerprint dystrophy, lattice dystrophy, granular dystrophy, macular dystrophy, and Fuchs endothelial dystrophy. Each type has distinct characteristics, including the appearance of the deposits, the location within the cornea, and the mode of inheritance. Treatment and management of corneal dystrophies depend on the type of dystrophy, the severity of symptoms, and the impact on vision. In mild cases, no treatment may be necessary. For symptomatic individuals, options include lubricating eye drops to relieve dryness, bandage contact lenses to protect the cornea and reduce pain, and surgical procedures to remove or replace damaged corneal tissue. Surgical options include superficial kertectomy, phototherapeutic kertectomies (PTK), deep anterior lamellar keratoplasty (DLK), and penetrating keratoplasty (PP), or corneal transplantation. The best treatment approach is determined on a case-by-case basis in consultation with an ophthalmologist. Currently, there are no proven methods to prevent corneal dystrophies, as they are primarily genetic conditions. Genetic counseling is recommended for individuals with a family history of corneal dystrophies who are considering having children. This counseling can provide information about the risk of inheriting the condition and available testing options. The prognosis for individuals with corneal dystrophies varies depending on the specific type and severity. Some dystrophies progress slowly and may not significantly impact vision, while others can lead to significant visual impairment. Corneal transplantation is often successful in restoring vision, but it is associated with risks and requires long-term follow-up. Research is ongoing to develop new and improved treatments for corneal dystrophies, including gene therapy and other innovative approaches, aiming to slow progression and improve visual outcomes.